Mental health is cognitive, behavioral, and emotional being in which an individual realizes his or her own abilities. The WHO stressed that mental health is more than just the absence of mental disorders or abilities. Peak mental health is about not only avoiding active conditions but also looking after ongoing wellness and happiness. Mental health issues are largely taboo in India. In 2017, mental health disorder were the second leading cause in terms of year lived with disabilities worldwide. Fortunately, several national and international organizations consider to include mental health policies as priority and make it a part of sustainable developmental goals. According to WHO, India's mental health workforce is severely understaffed. The number of patients are more than the number of psychiatrists and psychologists. Roughly 56 million Indians suffer from depression and 38 million suffer from anxiety disorder. Unfortunately, India has one of the highest prevalence of mental illness globally. National Mental Health Survey of 2016 found that close to 14% of India's population require active mental health intervention. Every year, 2 lakh Indians take away their lives, and statistics will obviously increase if we start to include the number of attempts to suicide. The Mental Health Care Act of 2017 ushered in a new era when it came to legislation on mental health in India. Keeping the United Nations Conventions on the Rights of Persons with Disabilities (UNCRPD) in mind, the law is now oriented towards the human rights of patients and accords certain freedoms and options to people living with mental illness, and their attempt to suicide is no longer a criminal offense. Patients have the right to live in proper accommodations. Providers of medical insurance in India must cover mental health illness. The government must provide required funds to ensure access to mental health care services, and the number of mental health professionals must be increased. The stakeholders identified by the Act to execute the provisions within it are the Central Mental Health Authority and State Mental Health Authority. The SMHAs are also obligated to form mental health review boards. All the mental health professionals need to register themselves within the respective boards. In order to redirect people with mental health illness towards appropriate care, instead of superstitious placebos, it is important to make mental illness free of stigma collectively as a society. When social stigma will be removed, so will be the self-stigma that people suffer from mental illness face very often. On an individual level, it is important for people to develop empathy and be open to listening to their suffering family, friends, or peers non-judgmentally. The small actions on an individual level will be responsible for catering big ripples of change as a society. Thank you for watching the channel Personoid. In future episodes, we will bring in psychologists and psychiatrists to know more about mental illness and psychological disorders.